Hello, I'm Dr. Brent Gibson, and tonight I want to talk to you about autonomic neuropathy and basically answer the question, what is it? So, to help you understand where this fits in the puzzle of peripheral neuropathy, a reminder is that the peripheral nervous system is the nervous system outside the brain and spinal cord. So the brain and spinal cord make up the central nervous system. The peripheral nervous system is everything else. And the peripheral nervous system is separated into two pieces: the somatic nervous system, which includes the motor and sensory nerves, and the autonomic nervous system, which is the automatic system of the body, the one body that controls the automatic functions of the body. But with peripheral neuropathy, you can also have a pretty significant autonomic neuropathy, where the automatic systems of the body aren't functioning like they're supposed to. So what are some of the symptoms that you'll see if you have an autonomic peripheral neuropathy? You're going to have a dizziness, lightheadedness, or fainting. The idea is if the blood pressure is poorly managed by the body is having a hard time expanding and contracting the blood vessels, then you're going to have a orthostatic type hypertension. So when you stand up, the body doesn't regulate it well enough, and you get lightheaded and can be dizzy and fainting and so forth. Exercise intolerance. One of the things that the body is designed to do is to, again, adjust blood flow based on exercise, based on activity levels. And when this is not functioning correctly, your heart rate won't adjust and so forth, won't adjust because the autonomic nervous system isn't working right. Sweating abnormalities and dry skin. So you're not releasing the oils or the sweat to the skin like you're supposed to because, again, autonomic system is failing. Poor blood sugar regulation. So the interesting thing is if you have a diabetes and you have a diabetic peripheral neuropathy, you can also get an autonomic neuropathy, which actually makes the diabetes situation worse. Difficulty digesting food. So if you have an autonomic neuropathy, you may have some additional stomach issues. The interesting thing is you've got two different ways of looking at is that the stomach issues that you're having, are they a cause of your peripheral neuropathy, or are they being caused by an autonomic peripheral neuropathy? Urinary problems, where your bladder doesn't clear like it's supposed to, doesn't do what it's supposed to, because again, it's not reacting the way it's supposed to by the autonomic nervous system. Vision abnormalities. So one of the things the autonomic nervous system does is it adjusts the pupils in the eye if they expand and contract and so forth. And if they're not working like they're supposed to, then you can actually get difficulty seeing and problems adjusting, especially in the evenings or when light is not as prevalent. And sexual dysfunction. All of those are common autonomic neuropathy symptoms if the autonomic nervous system isn't working like it's supposed to. So this is Dr. Brent Gibson, and this is Neuropathy Nugget Day 226, the autonomic nervous system. What is autonomic peripheral neuropathy? So tomorrow we're going to actually talk about how you will diagnose an autonomic neuropathy and differentiate it from, say, a sensory neuropathy or a motor neuropathy. Thank you. Have a great rest of your night.